Awesome. So, a little bit about myself. I'm Jyotpal Singh. I usually just go by Joe. And independent to this, I'm a research scientist at the Saskatchewan Health Authority. So, that doesn't have anything to do with my presentation today, but a bit of my background there. And I also do other research projects across Canada, across North America. Much of my work is focused on cardiac care. And very specifically, in the past 5, 6 years, I focused heavily on patients who have a very specific type of heart attack called a STEMI, or an ST elevation myocardial infarction. So, some of you may have heard of that. It's a very difficult type of heart attack to treat. There's a lot of research going on around this kind of stuff. And quite often, what we see, as some of what Holly teaches, is these patients have a lot of problems with cognitive functioning, with other aspects after their heart attack because of restrictions of blood flow and a few other things. So my background before the cardiac area was all focused around the brain health and neurophysiology aspects of why people feel the way they feel after some kind of injury to the brain. Why are there certain things that occur? So we're going to go through a little bit of all that today. I saw in the comments there, and it looks like it was posted to everybody. So Monique mentioned I was your patient number one in concussion study with Patrick Neary. Took 6 years, but I'm fully recovered. So that's amazing to hear. Of course, I'm not allowed to say that unless Monique first says it herself, right? So that's really exciting to see. And yeah, during my master's, we were studying something called post-concussion syndrome. So, for those of you who don't know, post-concussion syndrome occurs when you take a hit to the head, and sometimes 10, 12, even 15 years after your injury, you're still having symptoms. Often, it's just one heavy hit to the head that can cause these disruptions to occur. And other times, there's a lot of athletes who used to play sports like rugby and, these other types of sports that 20, 30 years ago, if you took a hit to the head, they used to just put you back in the field, right? And because of that, the constant hits to the head caused problems over time as well. So we started looking at something called cannabinoids, so things like CBD, THC. You probably see that in the news all the time. These kinds of compounds we started using to see if it would help recovery in some of these patients with post-concussion syndrome. And afterwards, we got funded by the NFL to look at this area as well. So that project is still ongoing at the university, even after I've left from here. My PhD was around the COVID time. So for that, we looked at new methods for monitoring heart function. And there was a lot in association with brain injuries and heart injuries at the same time, right? So we looked at long COVID, for example. A lot of patients had brain fog, excess fatigue, and these kinds of problems. And we actually were able to show that the heart and the brain were related with respect to what was causing the symptoms as well. Yeah, so that's a bit of my background. Now, Shania, I'll get you to actually go back to slide one. Perfect. So today, for the next about half hour here, we're just going to be talking about the aging brain, um, and why this is important to study as well. So, for me, my background, of course, is heavily clinical, heavily medical, with respect to the science. And as we know, your physiology or the way your body works, it changes and varies quite a bit as you age. This happens across your entire life cycle. So when you're children, for example, your heart and your brain, your lungs, even the number of bones you have, right? Everything is so different in comparison to whenever you're getting older. And during pediatric cases, almost on a every 2 to 3 months, your body's going to be changing. And this seems to occur all the way up until you're about 17, 18 years old. And then the progression tends to slow down a little bit, and your body starts to adjust thereafter. So, big thing is, all of us here have very different and very unique physiology as well. The way your body works is also heavily influenced by your lifestyle, the things you do, and all these things can cause, excess inflammation and a lot of wear and tear on your body over time, right? So depending on the way you live, your lifestyle, this is all going to affect how your physiology changes as you get older. So that being said, what about from a global perspective? Well, what's interesting is in 10 years, so in roughly 2034 to 2035, for the first time in North American history, we're expecting older adults to actually outnumber children. So it's expected that in 10 years, there's going to be more older adults than there will be children in Canada and the US. This might be consistent around the world, I'm not sure, but I know that's what the data suggests here, anyways. So because of that, this type of research work, like the science around aging, has really started to take off as well, just because we're expecting people to live longer, people to live better, and we're also expecting, again, a lot more older people, right? So because of that, it's important to understand, of course, what happens to your brain as you age as well. To add to this, by 2050, so in 25 years, it's expected that around the world, 25%, so 1 in every 4 people, is going to be over the age of 65. So all around the world, a quarter of the population will be above the age of 65. Um, and of course, this has to do with the way medical science is advancing. I was speaking to a research director at Google about 2 or 3 months ago, and he was telling me the same thing. The kind of research they're doing right now, he wouldn't be surprised if people are living well past 100 and super active still and moving around. And with the way they're now able to treat disease based on genetics and everything else, he was mentioning that it's just people are just gonna keep getting older and older and older, but they're still gonna be as healthy and active as they've always been. So it'll be very interesting to see how this changes over time. Okay, now the last thing I wanted to say is, there's this term called chronic illnesses. And chronic illnesses tends to refer to illnesses or diseases that stay with you for a long time, or they are first triggered as you're getting older, and then they stay with you for a long time after that. So you could think of things like high blood pressure, right? Hypertension. You could think of diabetes. You could think of these kinds of conditions that are considered chronic. Um, this idea is both positive and negative, and the reason it has some kind of positive connotations is because without people living longer, you wouldn't have chronic illnesses, right? So that's where the idea of chronic illness actually, being a marker of people living longer, is an important factor to consider as well. And another reason is because we're able to help patients sustain their symptoms and sustain their lifestyle alongside having some of these chronic illnesses. So with medicine, the way it's advancing, even if you have chronic illness, we're able to treat symptoms, we're able to treat some aspects of these illnesses, and that way, you're able to live longer and longer as well. Perfect. So Shania, let's go to slide 3 now. Awesome. So let's start with a relatively simple question, or what sounds like it's relatively simple. And the question is, what is the brain? Now, your brain, of course, is just a mass of about water and fat, right? It's about 60% water and 40% fat. But within this fat and these layers of water, there's a lot of different chemicals and proteins and really important blood supplies as well that feed your brain with the amount of oxygen and nutrients that it really needs. Your brain's main function is to maintain something called homeostasis. So has everyone heard about homeostasis? Yeah, awesome. Maybe from Holly's class before. And yeah, the whole idea with homeostasis is your body tries to stay as normal as it possibly can. It doesn't like to deviate too much from its normal change. And if it does, then your brain has a built-in mechanism that pulls it back to a normal state. This is also how your brain recognizes any kind of problem or complication that might be occurring. So if we take an example of, you're cooking, the stove in front of you is really hot. You put your finger on it, maybe on purpose, maybe by mistake, I don't know. And the nerves in your finger are actually able to pick up the heat that's being generated. And, your body doesn't realize right away that it's hot. It first has to send a signal through your finger, through your nerves, into your spinal cord, all the way up into your brain. Your brain has to process this information, and then it has to send it back down through the spinal cord into your finger, like into your muscle there around your finger, and then it causes your hand to move. So there's this processing of information that the brain is really, really important for. Um, Now, your brain as well, it's not only important for things like this, but it's also, as Holly was saying earlier, important for memory, important for emotion recognition. If you want to see things, your eyes first have to transfer all that information into your brain, and your brain has to make sense of all this information that's receiving to paint a picture for you as well. Um, so these kinds of things become really, really important, right? If you have some kind of area in your brain that's having some deficit, you can actually look at different parts of the brain to understand what kind of complication might occur from that. So if the back of your brain has some kind of problems, and we'll go through this in a little bit as well, there's a good chance that some of the colors of the things you see might become a little bit complicated because that's where it recognizes a lot of the colors and the shades of black and white and so on. Does all that kind of make sense so far? Yeah, awesome. Um, so your brain can, generally speaking, shift into two different sections. And I'm sure everyone's heard of this. There's one called rest and digest, and there's another one called fight or flight. Okay? So the rest and digest is called your parasympathetic nervous system, and we usually just call it PNS. And then your fight or flight state is called your sympathetic nervous system. And that one we usually call SNS. So your PNS and your SNS, they're part of a system called your autonomic nervous system. And similar to the way the name sounds, autonomic, it kind of sounds like automatic, right? So these are things that your body or your brain, like your body doesn't have to constantly think about for you to do. So you're all sitting here, you're all breathing, your heart is all beating at a normal rate. You're all paying attention, right? So these are things that your body does automatically on its own. So that's all done through your autonomic nervous system. And for me, that's my area of expertise is the autonomic nervous system. The whole idea here is they both work in two different protective mechanism aspects. If you're stressing out a ton, often your body automatically gets you to start taking deep breaths in and out, right? If you go to yoga or do anything like that, they also tend to get you to take a deep breath in, deep breath out, and have that kind of cycle going. And the whole reason they get you to do these kinds of breathing cycles is because it activates your parasympathetic nervous system. So it activates that rest and digest system that's in your body. So it's really cool. If next time you're trying to go to sleep and you just can't do it, all you have to do is slow down your breathing rate a little bit and just watch how tired you get and how quickly you get tired as well. It all has to do with your body triggering a response saying, hey, I'm not stressed anymore. I'm relaxed. I can go ahead and rest here. And on the other side, your sympathetic nervous system occurs when your heart rate starts beating so fast, you start breathing really hard as well. And actually, Shania, let's go on to the next slide here. Okay, perfect. So, and let's go through a quick example for the sympathetic nervous system as well. I took this picture a few months ago. I was actually in Banff. So that's an area called Lake Agnes. I think it's about 3 or 4 kilometer elevation from that fancy hotel that's out there as well. Um, and let's say you were out, let's say you were hiking as well, and let's say you were on your own. Okay, so you didn't have any help with you here. And all of a sudden you see a bear coming at you. Now, as soon as the bear comes at you, without even thinking, the first thing your body does is it triggers your sympathetic nervous system. So the first thing you would notice is your body temperature is going to go up. Okay? And the reason your body temperature goes up is because it wants, the more heat your body has, the quicker things are going to react inside your body. So chemical reactions, physical reactions, all these things happen quicker the warmer your body is. That's why before an athlete goes on the field or you get your exercise in, they say you should warm up a little bit, right? Um, it gets some of the blood flowing, and it gets your body more ready and active to actually do something. So right away, your body temperature is going to go up. And then as soon as that happens, immediate response to body temperature increasing is increased in respiratory rate. So you're going to start breathing a little bit heavier as well. Okay. And the reason this happens now is because you're going to start to try and bring in more and more oxygen and take out more and more carbon dioxide. Now, let's keep going here. The reason you want more oxygen is because your heart is going to start beating faster as well. So if your heart starts to beat faster, it's going to need more oxygen as nutrition. And when it gets more oxygen as nutrition, it can continue to beat faster as well. So your respiratory rate goes up, your body gets really warm, your heart starts beating, and all of a sudden, this bear has caused your body to go into a sympathetic nervous system state. So your body has shifted. You were all, you were out here hiking, you were all happy, relaxed, it was great. And then you saw this thing coming in right away. A trigger caused your body to switch. So this example, I bring it up because one, it's important to know next time you see a bear, you know what you should be doing. And then two, as you get older, your body naturally starts to shift, even under rest, even when you're not seeing a bear, right? Even under resting states, it starts to naturally shift to a sympathetic nervous system state. Okay. Um, Depending on the kind of lifestyle that you live, a lot of times at the hospital, like some of the research I've done, people come in, of course, they've been smoking chronically for 30, 40 years. They have at least one or two drinks every single day. They don't eat the healthiest as well, don't exercise very often. So I've seen a lot of patients like that. And often it's just because, they're working 16 hours a day and it's just hard to do anything else as well, right? So it's important to consider your lifestyle with all this stuff. But for an individual like that, their body would chronically be at a sympathetic nervous system state. Okay. So as you're aging, if you're continuing to exercise, if you're continuing to eat right, you can actually deviate from this kind of shift for a very long time. But individuals, who don't exercise as often as they should be or don't eat as well as they should be, their body is always stressed out. And when it's always stressed out like that, there's a lot of inflammation that can occur. So now, if you're reading the BBC News articles when they talk about health, and the top 5 superfoods for this and that, right? They always talk about something called inflammaging. So it's a combination of inflammation and aging. So they just put it together into a fancy word, right? They call it inflammaging. And the whole idea is as you get older, you're going to get more wear and tear on your body. You're going to get more inflammation on your body. And the more chronic inflammation that you end up having, the more stressed out your body is going to be. So it's going to be in this constant sympathetic nervous system state. Okay, so if you ever see yourself, and your teeth are clenched, your hands are always in a fist, and you're always feeling a little bit tense, it could be that you're in an excess amount of sympathetic state, right? There's just too much stress on your body. In those kinds of situations, I would say try controlling your breathing rate. Try inhaling slowly and exhaling slowly, because for your brain, that's the number one trigger to cause your body to go into a more rest and digest kind of state. And the other problem is it's kind of a catch-22 because your body, when it's in an inflammatory state, you get more and more stressed. But as the more stress you're under, the more it's going to increase inflammation, right? So it's a continuous circle that way, that unless you directly address the amount of stress your body's under, especially as you're aging, your body might get stuck in the sympathetic state, and that's what you have to try and address. Okay, does that make sense to everybody? Yeah, awesome. Okay, so Shania, let's go on to the next slide.
I have the survey ready. Do you want to launch it now?
Yeah, let's see how everyone does here. So I've brought a number of multiple choice questions, a little bit of a quiz here that you might be able to answer on Zoom. So here, if you were to, let's say at 70 years old, let's say you're out in Bath and you see this bear coming at you, how do you think your body would react compared to when you're, 20 years old?
Okay, we have some answers coming in.
Perfect. I'll give it 20. We don't have to, open up a textbook or anything to answer these questions, right? Although this bear looks so cute, I feel like it probably wouldn't even come after you. Just kind of sit there.
Okay,
Okay,
I think
perfect.
everyone at
So, Shania,
yes.
do you have the distribution?
Yeah, I think I can share it. Can you see
Perfect.
it now?
Oh, somebody would punch the bear in the nose, hey? Yeah. So I would shift to a sympathetic state and try to escape. That's great. I would start screaming, asking for help. 13% good. I would relax, and the bear will leave me alone. That's good as well. Um, Perfect. So the answer, this was actually a trick question because all of them would actually be a proper response here, right? And I'll explain why. Start meditating as well. Yeah, we will see how that goes. Yeah. Um, and the reason why is, of course, your body would shift to a sympathetic state, unless this is a situation where it's common practice, unless you just see a bear every single day and you're just no longer nervous or stressed, right? So, assuming, this is a rare occurrence, then yeah, of course you would shift to a sympathetic state. But then when you're trying to escape, under flight or flight conditions, you don't always think, right? And again, this is the whole idea behind that autonomic nervous system. Your body just automatically reacts. So, if your first response is to punch the bear in the nose, hey, that might be what you do, right? Through your sympathetic activation, to start screaming and asking for help. To be honest, that's probably what I would do. I would just start screaming as well or trying to run. And again, it's a reflection of a sympathetic response. Um, and this whole idea of I would relax and the bear will just leave me alone, it's kind of true. Like your body might go into a state of shock. And the reason I had this question is if you shift too far into the sympathetic state, your brain can actually recognize that as well. So if your body is at a point where, it feels like, hey, this guy's about to just have a heart attack, he's under so much stress, I'm going to try to reverse this a little bit. It can almost knock it the complete reversal, and you can go into shock, and you might just sit there. Um, Now, whether the bear leaves you alone or not is a completely different story, right? Um, and you see this in nature all the time where animals go into shock and they just end up sitting there, and you see like the other predators going after it, and the animal can't fight back because it's under so much shock that the brain triggered it to kind of respond back. So that's very possible as well. In this case, all these answers would actually be correct. It just kind of depends on the individual. Perfect. So Shania, let's keep going here. Okay. Um, So let's go into a little bit more of the sciencey stuff. Now, your brain and your nervous system. So your nervous system, meaning that autonomic and your parasympathetic, sympathetic systems. They have something called gray and white matter. So has everyone heard of gray and white matter in some kind of way? Yeah, awesome. So in the brain, your gray matter is kind of like the darker outside portion. And the white matter is like the lighter intersection underneath. So it's actually just named because of, if you were looking at it underneath a telescope, or sorry, underneath a microscope, this is the kind of reflection you would see back. Um, so your gray matter has something called the cell body of a neuron. Now, for those who don't know, the neuron is your functional unit in your nervous system. Okay, so what that means is all your signals in your nervous system, they're transmitted and connected from one cell to the next, and these cells are called neurons. So when the signal is going through the neuron, it has to go on to something called an axon. So that's almost like a wire, if you think of. And the plug-in, you can think of like the cell body, so the soma, they call it, of the neuron. Okay? This is really important because essentially in the gray matter, so the darker outer portion of your brain, it's almost all like the plug-in parts of the wire. So it's all the cell bodies of the neuron. And then in the white matter, you would see more of like the wire itself. So that's transmitting the signals. So you can imagine a lot of the processing occurs on the outer portion of the brain. However, in order for information to actually get to that outer portion, it has to travel through the whiter parts, right? So the white matter. And once it gets into the outer portion, it'll get processed, and then your decisions by your brain can be made from there. Okay. Um, let's think back very beginning. We were talking about putting your finger on a hot stove, right? So if we think of that example in this case, you have again nerve sensors in your finger, and essentially when the sends through your finger and it's trying to get up through your brain, the signal is traveling through that white matter. So it's traveling through the axon. Um, and the axon is labeled on here as well, right, on this figure. And as it's traveling through this axon, it has to eventually make it into the cell body or the soma that's in your gray matter. And then that's where it's processed, and your brain is telling you, hey, this is too hot. This is going to cause some kind of pain, some kind of damage. We're deviating from our homeostasis or our normal state. Let's find a way to stop this. And in order to stop it, the signal goes back into your muscle, and that's when your hand is able to move. So even motor activity or movement is triggered by this gray and white matter response from your brain. Okay, does this make sense? Yeah, awesome. And with respect to age, so Shania, let's go to the next slide. I have another multiple choice question for everybody. What do you think happens to gray and white matter communication so that relationship between the axon and the soma and the gray and the white matter, what do you think happens as we get older? And Shania, let's make this active as well, this poll. We'll give 20 seconds here. Okay, perfect. So how are the responses looking, Shania?
I think everyone, yeah, let me show you.
Okay, 82% said all of the above, which is great because that is the correct answer. So if I was marking this for this one, I would say there would be a correct answer. It would be the all of the above, but of course, all of the answers actually apply in this case as well. And let's think about this for a few minutes here as well. As you get older, and another thing I want to really emphasize is there's always ways to either reverse or slow down these kinds of processes. We're looking at a few therapeutic options and interventions. During my graduate school and postdoctoral work here, we were looking at cannabinoids to see if we can help reduce some of these risks. We're also looking at different types of exercises like weightlifting versus aerobic exercises. Um, all in all, it seems like any kind of exercise is really good to help reduce these deficits. But if you're generally sedentary and, if your body has a ton of inflammation from the kind of lifestyle, then we do tend to see these kinds of changes quite often. The first one is reductions in volume of gray matter. Okay. So, what these people have done is they have brain tissue of individuals who are 80 years old, 70 years old, 60 years old, like every decade essentially in life. Um, and they're able to take this brain tissue and they're able to put it under a microscope and they can actually measure the amount of gray matter and white matter that's in the brain. And it's really, really cool stuff. The way they do it is they put different types of dye that are chemically active based on which area of the brain you're looking at. So when you look at it under a microscope, you could see different parts light up. And then based on that, you can actually tell how much of one material is in the brain versus another. So in this case, when we consider reductions in volume and gray matter, this means that we have less area in our brain to actually have processing occurring. Depending on where this is in the brain, so if it's in the front part of the brain where you're losing a lot of volume, that's important for things like muscle movement. It's important for things like speech control, right? For cognitive function. So when you're trying to reason, when you're trying to, critically think and make decisions that way, that front part of the brain becomes really important. So if you're losing a lot of volume there could become problems with trying to do some of these things because your brain's not processing that information properly. On the other side, if we're losing white matter, if you think about it, white matter again is the one that sends that signal into the gray matter. So by losing more and more white matter, you actually end up having less of the signal even reach the brain to begin with. So your brain has nothing to process, right? So the more white matter you lose, the more gray matter problems you end up having. On the other hand, if you have enough white matter, but your gray matter is breaking down, your body's just not processing the information properly, so it can't react to things as it should be. Um, Around the age of 75, this becomes more and more prominent. Um, but generally speaking, with more research, it's becoming more evident that depending on again how lifestyle is controlled and how much exercise and so on is done, you can actually help control a lot of these factors as well. If you're starting to lose gray matter volume in the front of your brain, um, and if you're starting to lose white matter volume as well, what ends up happening is your body reacts to this by trying to increase the amount of inflammation because it thinks that it's some kind of disease that's causing these things to occur. So if you have more and more inflammation as well, again, this is going to trigger internal reactions where uh, your aging process, in combination with your gray matter, white matter deterioration, is going to shift your body into a sympathetic state. So, even with this gray matter, white matter problems, with the amount of inflammation, it accelerates that shift into sympathetic state again as well. Okay, so it always comes back to that sympathetic parasympathetic state, just because that's just how your body tends to react to different kinds of stressors in its environment. I think I saw a question that was asking, how do you test for some of this, right? Is it CT, MRI, or by looking at the actual brain tissue? So it's interesting. Like most of the studies look at cadavers, right? So they look at the brain once the individual has passed to identify some of these things. But there are more and more surrogate measures now as well. So the problem is with these surrogate measures, if you're using an MRI, CT scan, and we'll talk about something called a functional MRI in just a little bit as well. But these types of testing modalities for gray and white matter aren't always the most accurate, right? You can get a general idea, but you would just need a ton more tests before anything can be confirmed in this case. So right now, this gray matter, white matter application, much of it is heavily on the scientific side to try and create medications, to try and understand why, some things in aging can cause the kind of problems that they do, right? With science, people say, I'm sure everyone has heard of something called evidence-based, right? Whenever you give a medicine, it should be evidence-based, meaning it should be based on studies. Whenever you bring in a new therapeutic option, it should be evidence-based, right? But higher level than evidence-based is called science-based. And with science-based, it means, okay, now I have all the evidence. Can I come up with a mechanism, or can I come up with a reason as to why this occurs? And as soon as you can come up with that scientific reason as to why things are occurring the way they are, that's when you know it's no longer purely a theory, right? There's an actual application of this as well. So that's the idea right now, is a lot of the modalities outside of, taking some tissue from your cell and testing it, there's a lot of limitations with those kinds of measures at the moment. Perfect. So Shania, let's keep going. Awesome. So before I keep going here, I just want to talk about something called functional activity. So everyone has heard of an MRI scan, right? Yeah, I'm sure a lot of people have had an MRI scan. They're very common from the time you're 2, 3 years old all the way to much later in life as well. Actually, in the hospital, we just introduced something called a portable MRI scan. And it's a very interesting type of scan where we can bring it to the patient's bedside. So we're using it for pediatric cases, like before. We used to have to take patients, bring them into the big MRI scanner room, and people were really uncomfortable there. It's not the most welcoming environment, right? A big magnet, very loud. And actually, what a lot of you may not know is many of the complications or the risks of things like an MRI is the transfer from your patient room to the MRI room. If you think about it, the hospital is so busy. There's so many wires and tubes and potential catheters and other things that are connected to you. So just bringing you to the MRI room is probably where 50% of the problems actually occur, just in that transfer process. So if you can eliminate that, you're eliminating so many of the potential risks that come with trying to get an MRI, right? So this is something experimental that we're just assessing, but maybe in the future, once it's more applied, I'll come back on and I'll let you guys know how it's all going there. But with MRI scans, generally you get a very stationary image of your brain. Things like cancer are really important to detect using an MRI. If you have a fracture, if you were in a vehicle accident, all these things, an MRI becomes really, really important because it can scan and tell you where some of the problems might be. Now, let me give you an example. Let's say you have a mild traumatic brain injury, okay? So traumatic brain injuries could be severe, they could be moderate, or in things like if you're driving a car and you hit somebody and you get a whiplash, right? Your brain can move in your skull, and that would be a mild traumatic brain injury because the impact isn't directly on the brain that way. So, do you think you would see anything in an MRI if the impact was mild? Yeah, I feel like I was leading with that question a little bit, but generally speaking, it would be very tough. Like, there's chances that you might see something, but what happens in a mild traumatic brain injury, like a concussion, for example, right, is there's problems with the way blood is being distributed around the brain. There's problems with the way the amount of oxygen your brain is using from the blood is being metabolized. Okay. So, with that, you generally need something called a functional MRI. Functional meaning we're measuring the way blood is moving through the brain. I don't know if we actually have one in Regina or not, a functional MRI. I'd have to look back and check. I think in Saskatoon and Alberta they have a few, but it's usually the if you're trying to understand at a functional unit, like if the MRI is not showing anything, but you're still having symptoms, generally the next stage that people end up taking is a functional MRI. For concussion, like I've seen thousands of MRIs, and almost in every single case, it hasn't given me information I can actually work with, unfortunately. So generally speaking, for those kinds of situations, a functional MRI where you get information about the blood and the way it's moving and metabolizing makes a lot more sense as well. So if we look again at this figure here, everyone can see this brain figure, right? We have the frontal lobe, so that's the front part of the brain, and it's involved in things like decision making and movement. Things like we spoke about earlier. So if you're losing a lot of gray matter in the front part of your brain, you can get things like motor problems. In Parkinson's, you tend to see some of these things, right? There's some motor issues with Parkinson's as well. And a lot of it could be due to potential gray matter complications in the frontal lobe. Um, you also see hesitancies with decision making, cognitive function decline. So often we run something called a Montreal Cognitive Assessment Test, or a MOCA. If you see your neurologist, I'm sure they've made you draw a clock and put, the time, count backwards from 10, those kinds of tasks, right? And that tests something called mild cognitive impairment. Okay. The earlier you can catch mild cognitive impairment, the better you can potentially treat it over time as well. So these things can occur when you have problems in your frontal lobe. And we also have the parietal lobe, and this lobe is more important for spatial understanding. Helps you, identify objects, things around you. It helps you also interpret pain. And as Holly teaches as well, it's we also have Wernicke's area around close to this part as well. So, things like language and so on are also important to process through the parietal lobe. Um, and then the occipital lobe is in the back of your head, and this is really important for vision. And the whole idea here is, as light is entering your eye and it's going through the lens, it eventually makes its way all the way back to your brain, and then that's where all the image and color processing actually occurs. So again, based on the kind of problems that you might see, it could have to do with the different areas of the brain where there's problems with gray matter, or there's just not, for example, enough blood going to that area. And if there isn't enough blood, you don't have enough oxygen, so you're not feeding the brain properly, and that could also be causing some of these problems. Shania, let's go to the next slide. And I know I'm going a little bit over time here. I just need maybe 10 more minutes. So we talked about functional MRI, and again, you could see the brain here. You could see like the little red spots, right, and the blue spots and so on. So the redder the color, it just tells you there's more and more blood going into that area. So there's more and more oxygen being used in that area as well. There's also new ways now to test how much oxygen your brain is using. And actually, one of these devices Holly has in her lab at the U of R here. And it's simply a cap. You could just put it right on your head. And by sending different types of light into your skull, it's able to pick up how much of the blood is carrying oxygen and how much is not carrying oxygen. By understanding these two areas, or these two things of carrying and not carrying oxygen, you're able to understand how much metabolism is occurring in the brain. If you have a lot of deoxygenated blood, so blood without oxygen, it means that either the oxygen is being used up too fast, or your blood isn't bringing enough oxygen to begin with. So that's where there could be some problems, right? And at the same time, if there's way too much oxygen and none of it's being metabolized, right away we know there's another problem there as well. So about 4 years ago, maybe 5 years ago, and 2025, 6 years ago, I was out in Victoria, and in British Columbia here. And when I was in Victoria, I was working at the university for 2 weeks, and we had about 100 people come through the lab, and we put this kind of machine, this functional near infrared, this kind of cap that tests blood and the amount of oxygen on these people's brains. And we were able to show that individuals who used to play sports like rugby, like football, um, in comparison to individuals who played sports like tennis, golf, um, there was so much difference in the way that their brain was using oxygen. especially the older individuals. So our average age was about 70 to 75 for this group of about 100 to 200 people that we tested. And those who participated in contact sports when they were younger, they had a very impaired ability to metabolize the amount of oxygen. And they would have symptoms come up a lot quicker when we would make them go through different kinds of tests compared to people who didn't play these kinds of sports back in the day as well. Now, a lot of these guys used to tell me that, there, because one question we ask is, how many concussions have you had in your lifetime? And the rugby guys would tell me, well, I used to get hit, knocked out, I was on the sideline, and as soon as I woke up, the coach threw me back in, right? So they were like, that's just how I was back in the day. And that just would not work now, right? So we're really starting to see the kind of consequences that this type of approach can have where the concussions aren't treated as properly as they should be. And we have a ton of data now to back this up as well. So I think as we move more and more in the future, concussion is going to become more about objective markers, like how much oxygen is your brain using, and less about symptoms, because turns out about 80% of athletes will downplay their symptoms, of course, just to get back in, because that's often how they get paid as well, right? So it's a little bit of a sensitive issue for them in this case. Okay, Shania, let's keep going. Perfect. So now, one thing that we should consider thinking about is, how is the brain actually protecting itself? And this is the last bit of neuroscience I want to go through here. But your brain has something called a blood-brain barrier. Okay, so there's lots of different blood vessels going into all different parts of your brain. And the biggest supply in the brain here is called the circle of Willis. So if you ever hear your doctor talking about the circle of Willis in your brain, all it is a network of different blood vessels that's being used to feed your brain with enough blood so it can get enough oxygen and nutrients as well. Now, this circle of Willis and all these other vessels around your brain, they have cells that are very tightly packed together. So if you could see on the figure here, they have very small cells that prevent things like bacteria, pathogen, viruses, and so on from going through the blood and into the brain. Your brain is very selective on what it allows to actually enter the brain because it wants to be very protective, right? So as you get older, and again, the amount of inflammation that may have built up over time, that all affects your blood-brain barrier integrity. So if there's too much inflammation, if you haven't, again, been exercising, been eating properly, been smoking or drinking way too often, all of this stuff can really cause your blood-brain barrier to become leaky. So once it becomes too leaky, it opens up a little bit more and viruses and pathogens can start to cross into your brain from your blood-brain barrier. Now, this again occurs heavily in a sympathetic state. So if your body is too stressed, it's true what they say. My mom always used to tell me stress is the number one killer, right? And it's true. Like the more stress you take on, the more your body just starts to get affected in so many negative ways, including from the blood-brain barrier. And if this barrier becomes too open, too many things can cross in. It can cause problems to occur directly at the site of the brain. And I don't know if people have heard of this thing called CTE. No, it's called chronic traumatic encephalopathy. So the whole idea is, if your blood-brain barrier becomes too leaky, a lot of these proteins can start depositing into your brain. And once they deposit into the brain, it essentially blocks off certain parts of the brain from getting enough blood. So it starves the brain of oxygen in a few areas. And as soon as your brain's being starved for oxygen, it's the number one trigger for a stroke to potentially occur as well, right? Now, if you take a look at an NFL player's brain in comparison to a individual who didn't play contact football, their brains look like night and day. Like it's so different because of how leaky an NFL player's blood-brain barrier would be, and because of how much CTE development they end up having. It's often why people who play in the NFL, by the time they're about 40, 45 years old, there's just so many neurological problems that start to occur at a very young age, right? Um, yeah. The other thing I wanted to mention is a bit more recent research. I'm not sure if anyone remembers this whole COVID pandemic that just occurred. Um, it feels like so long ago, but it's still all around us as well, right? So it's very um, interesting in the sense that research is now still picking up on COVID. And we're now starting to see that even in healthy individuals, the COVID virus was actually able to somehow cross the blood-brain barrier. So even if your barrier was tight and compact, in some people, depending on how much of the virus you had, it was still crossing through and getting to the brain somehow. So people were having a lot of brain deficits, and this might be one of the reasons why we're thinking for long COVID, or for patients who still have symptoms after having severe COVID-19. It might be something related to the fact that the virus somehow got directly into the brain itself there. I also saw a comment here about, one second. Oh, from Monique. Is there a way to repair a leaky blood-brain barrier? So, yeah, everyone's asking the right questions today. It's tricky is the only way to respond to it. You can rehabilitate it is probably the best way to put it. So exercise actually has shown to slow down the regression quite a bit. There's certain medications as well that can help um, restore some of the integrity in the blood-brain barrier. But the biggest thing is to try and reduce as much inflammation that's directly impacting your brain at the site of the blood-brain barrier. And the whole idea for that right now seems to be heavily through exercise, heavily through lifestyle control, and keeping your body weight under a certain level as well. So being away from that sympathetic state seems to be important too. But the medications right now, there's just no double-blind randomized control trials is how these medications have to be certified. So there's no study like that that has shown direct impact on the integrity of the blood-brain barrier as of yet. What I think personally, some of the research we've done before on cannabinoids, it's starting to really pick up. So this CBD compound seems to have a direct impact on the blood-brain barrier, but it's only been shown in mice. So in humans, I don't know yet, right? But it's been shown to actually restore some of the deficits at the blood-brain barrier. And the problem is, until we do human trials, we don't know if it's going to have that same level of impact or not. Now, this is also important because medications are now designed specifically to cross into the brain barrier as well. So things like antidepressants, anxiolytic medications, so to help with anxiety, sedatives, medications that treat seizures, epilepsy, those kinds of medications, they have to cross the blood-brain barrier as well. So once they do, they're able to help treat direct cognitive impairments at the brain too. Routine things like alcohol also cross the blood-brain barrier. So if you think about too much alcohol intake, again, it's able to cross through and directly impact the brain that way as well. And because of this, you get these difficult situations where you really have to think about how much are you intaking, what kind of effects is it having on your brain. And the things that you intake that directly cross your blood-brain barrier, again, increase the amount of inflammatory response there as well. It's almost like if we can keep the integrity proper of the blood-brain barrier, you tend to reduce the risk of potential future problems occurring as well. Okay, so Shania, let's keep going. Oh, I think there were actually a few questions as well. We'll leave this question and just go on to the next slide. Perfect. So let me take a look at the questions really quick, just because I know I've gone 10 minutes over time here. Is there a way, I think that one we addressed. Are there some exercises better than others for repair of blood-brain barrier? So aerobic activities seem to be really good in the sense that, they're easy to take up and progressive overload is easy as well. So you can start by walking. then you can continue to progress by walking a little faster and a little faster, or even a little bit longer and a little bit longer, and try to progress that way. But even resistant exercise seems to be really beneficial for the brain. But again, there's just no study that's compared aerobic versus resistance training in order to try and address things like the integrity of the blood-brain barrier. It's too, I think, difficult of a study to initiate because first, you have to be very specific with how you're measuring the integrity as well. And that's another research study or project that's still being developed, right? So there's no direct measure for this, again, except under a microscope or in mice. So it becomes a little bit difficult that way. So what impact do high doses of statins have on the brain? So this one I actually don't know, and I could try to address it in from what I understand from the physiology, and what I've read on the medications of it. So whenever people come in with statins, you know, generally speaking, they're trying to fix their blood pressure problems, right? So with statins, what they can do is imagine your blood vessel is very tight like this. If you take a statin, it slowly starts to dilate it a little bit. So it starts to open up a little bit. And the reason statins have this effect is because as blood is going through, if your blood vessel is too tight, the blood hits the wall really hard. It has a hard time getting through, right? So that's what's causing the high blood pressure to occur. And as statins help increase or dilate the blood vessel, it can actually help increase the amount of blood that's flowing to your brain as well. So it can help improve some of the blood flow that's going to the brain. But if there's any other type of negative consequence that comes from that, there likely is, but unfortunately, I just don't know that area of research too well. Okay, we don't care if you're. Oh, I thought that was a negative comment. That's okay. Oh, perfect. Well, I'm glad everyone's enjoying it. So, Shania, let's stay on the slide for a second. One second. There's another question came in. Aren't statins taken? Yes, but I was trying to address it in the sense of how would it affect your brain, right? Generally speaking, high cholesterol, high blood pressure, high lipoprotein, high lipodiol as well. Like they all kind of come together, and statins are commonly used to address a lot of these things, just because the medication profile that you're given tends to help dilate the vessel. The other thing as well is the reason you want your vessels more dilated and allow blood to pass through is because if you have excess cholesterol buildup in your vessels, it can harden, right, against your vessel wall. And imagine you have like a tube and you have a bunch of stuff stuck on the tube. If you have a bunch of water that's flowing through it, one of those things can fall off and block off the water, right? It's the same thing in your vessels. So if you have enough blood flowing through, if your blood pressure is too high, if you have too much plaque buildup and too much cholesterol, it can knock one of these plaques off. This plaque can travel into your brain, for example, and if you have a plaque in your brain that's stopping blood from occurring, that's by definition a stroke that's occurring as well, right? So um, these things all kind of go hand in hand in this case. Yeah. So I was trying to address it based on that a little bit. Okay, so that's again, prevalence of common conditions with age. We spoke about inflammaging, right? So this idea of inflammaging with plaque buildup and everything else, excess inflammation also disrupts plaque. So if you do have a buildup of plaque and a potential clog that can occur, that can also cause things like a stroke, or if it stops blood from going back into the heart, that can cause a heart attack to occur in that case. So the whole idea here is too much inflammation, a poor diet, and not enough exercise. These things can cause excess plaque development that can, starve different parts of your body from having enough oxygen coming in. And then we also see neurological deficits as well. So things like Parkinson's and Alzheimer's become conditions that are prominent with age. And a big reason, this is all very much under research as well, right? I know Holly's area of expertise or interest as well as Parkinson's, but we tend to see often functional problems that occur with Parkinson's and Alzheimer's. So, if you don't have enough blood going to certain parts of the brain, for example, the frontal lobe, you're going to notice that there's impaired frontal lobe activity. And in combination with inflammation and a leaky blood brain barrier, this can also cause the potential for problems like Parkinson's to actually accelerate over time. With not enough gray matter in the brain as well, you're going to have processing problems, which can also accelerate some of these neurological conditions. And as you get older, I think the prevalence of some kind of mild cognitive impairment for people above the age of 70 is getting close to about 30% across Canada. And if you exercise, in exercises, this drops down tremendously, right? So exercise seems to be a very, very beneficial type of intervention in this case as well. Okay, and let's go on to our next slide, Shania. Perfect. So I just want to read this out loud here as well. So while age is a risk factor for brain-related diseases, there are numerous proactive steps you can take to maintain and even improve your brain health as you age. This includes staying physically active, engaging in cognitive challenges, adopting a healthy diet, and more, all of which you've learned about in Holly's brain health classes and through this incredible community. So keep up the great work, everyone. And yeah, I hope today's presentation was informative. My area of expertise has always been the way the brain and the heart communicate with each other. Even when we look at concussion, we look at this thing called the heart-brain axis. The way your heart responds to changes in your brain and the way your brain responds to changes in your heart. So it's very interesting stuff for me. And, research is now building on how is aging affecting this axis as well. So, once we have more studies coming out and more research to share, I'd love to come back and give an updated presentation that way. Perfect. So we can go to the next slide here, Shania. And that's it. Thank you very much, everyone. I see some questions are still coming through. Oh, I'm glad everyone liked the presentation. That's great. Do you also look at heart rate variability? It's a funny question. I'm actually one of the world experts on heart rate variability as well. So, so much of my research, I've published maybe 20, 25 different high profile manuscripts on heart rate variability. And heart rate variability is the deviation on a beat to beat basis in your heart. So, for those who don't know, I'll give you an example. Let's say your heart rate is 60 beats per minute. That doesn't mean every single beat in your heart is at 60. It could be 70, it could be 90, it could be 50. There's so much variation, right? But on average, it's going to be 60. In healthy conditions, we tend to see more variation. However, when you're in a sympathetic nervous system state or an excess inflammatory state, we tend to see a much more compressed or restricted heart rate variability. So I've been able to show through the work with my lab here that in people with some kind of cognitive impairment, there's so many problems with heart rate variability. Heart rate variability will directly affect your blood pressure variability, something called baroreflex sensitivity. And these are all things that I'd love to go into, but it might be for a different presentation once I have new slides and everything.
Shani, can you take off the PowerPoint so we can and pin Joe? There we go. You're pinned, Joe.
Oh.
Okay, any other questions for Joe?
Perfect. Well, thanks, everybody.
Just give them another minute. Any questions, just unmute yourself or put it in the chat.
So both fight or flight, I understand there's also freeze. That would still be SNS, even though it's basically a lack of mobility, lack of movement.
Sorry, like, was the question for fight or flight or sympathetic state if you're not moving?
Well, there's fight or flight, and I understand there's also freeze. And
Okay.
so freeze would also be SNS, even though there's no movement. You know, I mean,
Yeah, I see what you're saying. So it's a good comment. I'll give you maybe another example. Have you ever seen like a boxing match? You know how sometimes in boxing, when a fighter gets hit right in the liver, their body just drops all of a sudden, right? So when it drops, their body's actually shifted all of a sudden to a rest and digest state. So their body has frozen, but they're actually in a parasympathetic state because their brain has sent a signal through the body saying, okay, we're too stressed, we can't handle this anymore, we have to flip a switch. Same thing if we think about the bear example. You know, if the bear is coming at you and your sympathetic nervous system goes into overdrive, your brain can actually try to trigger an immediate response to try and put you into parasympathetic state, but it's such a big overcompensation, right? It overcompensates to the point where your body just freezes. So you're just in such a rested state that you just can't respond to it because your brain is trying as hard as it can to maintain any kind of homeostasis that it possibly can. Does that make sense?
a lot. Thanks very much.
Perfect.
Joe, we have another question. Can you talk a little bit about brain tumors and how are they similar to concussions, or are they similar at all to concussions, brain tumors?
Brain tumors. I guess so. A tumor, of course, would be, a cell that's aggregated over time, right? It feeds on its environment. It gets bigger. Your body recognizes it as a foreign pathogen, so it tries to attack it, and it causes a whole bunch of different types of physiological responses than concussion would. I think maybe what the question is asking is, are symptoms similar, right? That's what I would assume from that. So if we consider symptoms, you can see a lot of similar symptoms in between them. Both will come. So with concussion, there's something called a sport concussion assessment tool. And it's a list of a whole bunch of symptoms where you give a number between 0 and 6. 6 being like, wow, take me to the hospital right now. This is too much pain. 0 being nothing at all. So things like headache, fatigue, fogginess, anxiety, depression, all these different kinds of things are associated with concussion. And some similar symptoms can be seen if somebody has a brain tumor as well. But physiologically, they're very different. Like, consider an MRI scan, for example. You know, if you have a brain tumor, in the majority of cases, unless it's just a super complicated case, but in the majority of cases, an MRI will be able to tell you exactly where that brain tumor is. You'll be able to pick up the brain tumor, especially, if it's been there a little bit too long and it's continued to aggregate and get bigger and bigger. Whereas a concussion, you would have to look more at the blood flow around the brain in order to understand what's going on. So physiologically, there is quite a bit of a difference.
Okay, thank you. Any other questions for Joe?
I have one. Yes, I have one as well, Holly.
Okay, go ahead, unmute yourself or put it in the chat. Kathy.
Can we go back to the freezing issue? I'm just wondering if I've got this straight. Let's say somebody has Parkinson's and they freeze in place, which is a common thing with advanced Parkinson's patients. Does that mean that the brain's overwhelmed and flips to the parasympathetic system? Is that what you're saying?
No, so
Oh.
that would be in so in these kinds of cases, I guess, who am I speaking to as well?
Jennifer.
Oh, hi, Jennifer. Nice to meet you.
The Parkinson Society in Regina.
Oh, okay, cool. Yeah, so in these kinds of cases, it'll be dependent on the condition. So the example I gave before was somebody with no other condition whatsoever in a general state. What would occur?
Oh.
If your body's under an excess amount of problem like that. In Parkinson's, it's quite different because there's motor deficits already, right?
Right.
So
In
if
the
you consider,
frontal lobe, then, like you were talking about?
exactly, yeah. So
Okay.
that would be the first thing to consider. It could be, again, a combination of 100 different things, right? But the
Okay.
first thing to consider would be, okay, the frontal lobe is probably the main area that's processing the information to allow me to have motor movements and motor control. Well, if I'm having problems with the way I'm moving and my motor control, there might be reduction in gray matter at the front brain. There might not be enough blood in the front brain, right? There might be a
Okay.
loss of activity in the front brain, so that might also be causing it as well. So freezing in Parkinson's would be quite different than, for example, if you are able to go into a rapid sympathetic state, but it just gets so overwhelming that you panic and freeze that way.
The way I understand it's two different meanings of the word freeze almost, right? Like you
Exactly,
if
yeah.
you come across a bad accident, you see all this blood, your body can just freeze versus
Okay.
Parkinson's freezing. Those are same
Two
word,
different.
two different meanings. There's the
All right.
linguist. That's the linguist background for you.
Okay. Thank you. Thanks
Yeah.
for the clarification.
Joe, it's Donna. When you were talking about functional MRIs and not having a machine in Regina and just Saskatoon and Alberta, is it not a benefit that we have one in Regina? Can you speak to that?
Oh, I'm not 100% sure if we have one or not. From what I last remember, we don't, but I'm not entirely certain. But it would be tremendously beneficial, of course, yeah, to have a functional MRI here, just because you get so much more information, right, about the brain. And for individuals who, for example, an MRI might not show everything they need to know, having a functional MRI can be just another tool, right, that can actually provide you with more answers in this case.
Mm-hmm.
Yeah,
Okay.
and especially with, having to travel, like often Saskatchewan being so heavily on the rural community side as well, right? I think something like 50 or 60% of Saskatchewan, you have to travel at least an hour, hour and a half, right, to get to any kind of major location. So the more widespread things like functional MRIs can be, the better.
Can I ask one more? Heart rate fluctuations, the control of it seems to decrease with age. And as one gets older, if it starts spiking to 180, 190, risk of stroke just elevates greatly. Anything to be done about this kind of a loss of heart rate control as one ages?
Yeah, no, that's a good question. Like with heart rate, usually if you want to calculate your maximum heart rate, what you have to do is go 220 minus your age. So that's the rough estimation, right? So for me, I'm 30 years old, so I'd be 220 minus 30. It put me at 190, would be my maximum heart rate. And that's usually the peak of where I would want to be at if I'm exercising at the hardest I can. As you get older, this drops, right? So if you're 40, it'll go to 180. You're 50, your peak would be 170, and so on. So the whole idea here, I guess, is your question asking how do you better regulate your heart rate?
Well, if it just has, not me specifically, but if it has just from time to time, more often one wants, you find yourself, it spikes to 180, 190, got to take some medication quickly to drop it down, or else, stroke will come eventually,
Exactly, yeah. So the faster your heart beats in a resting state, it can potentially backlog some of the blood, right? Because it might not all get out. The more blood backlogs in the heart, the more it can thicken, and then it can send up thicker, for example, like thicker type of blood that can cause a clog to occur, right? So that's where the stroke could potentially come in. So yeah, in this case, it'd be so specific to the individual because there's 1,000 things, right? That can, it's a little bit hard to speak in generalities to that kind of specific case. So I'd have to just know more, unfortunately, about the specific case. Yeah. And all in all, you know, with research and with the kind of research I do, in order to be included in a study, our inclusion exclusion criteria is so strict. So we can only say certain things about certain cases, and it's hard to generalize things sometimes out of that. So even in research, you have to know so much about one specific individual. That's why when you go to a doctor, full workup, you get lab work done, physical exams, everything done on top of all your general basic medical history stuff too, right? Because everyone's individual, right? Your physiology is so different, the life you've lived is so different, the way things have affected you as you've lived your life are very different as well. So all these factors become really important.
And as far as
Um,
great variability, Thomas, from what I understand, and Joe, you
Mhm.
know more about this than I do. If you are very stressed, that affects your heart rate variability.
Of
And all
course,
this
yeah.
exercising is going to help. So all those healthy lifestyle things as well. Is there one, I feel like we have to kind of wrap up because it's after 12 and I like to honor the time because people
Yeah,
go for
and I
their
see
healthy lunch.
there's one question as well where Monique was asking if you can donate your brain if can we donate our brains after we die? Yeah, so you'd have to speak to the neurologist about that, Monique. I think they have specific documents, paperwork, all that kind of stuff, and then they can direct whoever that way as well.
Thank you for catching that.
Mhm.
So what time for one last question and then we're going to wrap up. So I do believe that we're going to have a follow-up email where you can put in your responses. This session, this class was as a result of a few people saying that they love the science. Can we bring on a scientist? So again, this is your community. Think of me as trying to honor you as an individual and what you're interested in. So I brought Joe on for an interest in science, and we certainly got way more people than I was expecting. We had 70 people sign up. So, and I think Joe was a hit. So again, we need you to give us your feedback. What do you want? Where do you want to see this go? And also, like I said, I am going to be offering 2 level 1 courses that people have to pay for. So please tell people about this. You can take it again, but this time you have to pay. Or you're welcome to. We're going to have a limit of 30. And but if you want to tell people, especially in the rural communities who can't get into the city, because I teach this in person as well, share that information that way. I'm doing 1 level 2 class. People want a whole series, but if you could see how many different requests I get for different topics, you could see how hard it is for me to choose what would level 2 be. So I'm trying 1 session level 2 on March 19th. You'll get that link, and that's learning and memory. I'm giving a huge talk for the Alzheimer's Society. There's going to be 700 people registered and 1,900 people are going to get that. So this interest is definitely growing, and you know, the 16 of you who started me out, you know who you are. And now, like I said, we're over 200. So again, this is very much your community. You tell us what you want, and we're gonna try to see if we can bring it on. I don't think there's anything else I want to say oh, sorry, you go ahead.
Yeah,
Jan?
so thank you everybody for being here. Thank you, Yo. With Yo permission, you're gonna have the recording of this session on the follow-up email. And all of the information that Holly just say about level 1, the class on level 2, the 2 groups for level 1 and the 2 different schedules for it, you're gonna be receiving it on an email starting next week. So just make sure you check your email because you're gonna get a lot of Holly stuff from now on.
Yeah, and Joe and I are I want to thank Joe too officially, but Joe and I are very excited about something, and that is we wrote an article with other students. Joe, he's humble, he doesn't brag enough, but everyone goes to Joe, cardiologists, everybody, and the medical students. One first-year student just won a paper in Saskatchewan. I mean, he won it all across Canada about the best medical paper that a student has written, competing with year 1, year 2, year 3, and year 4. Someone out of our lab won that last year and was sent to Ottawa for that recognition. And when I talked to him, actually, I saw him last night at the Harry Potter thing. He was right behind me. and when I asked him, how did you write this? He said, Joe was my go-to guy. So Joe is the kind of guy that everyone goes to for research help. And anything he touches, that person tends to turn to gold. The Midas touch. He's wonderful and he's humble, and we're so truly lucky to have him in the health district right now. Wherever he goes, he's helped me a lot in research. But Joe and I are very excited because we wrote an article with these students. Joe was definitely really the brains behind it, and I have funding and all that, but it was one of the highest viewed articles in a very good journal all of last year. So Joe keeps saying, this is incredible. This is incredible. And again, it's not me, it's truly Joe. So thank you, Joe. And I want to thank you very much, Joe, for being here and speaking to us as if we are I said to him, your moms and your aunts and your dads and your uncles. Don't get too high up for us. I think he did a fantastic job. And if you're like him, we're going to send you some, what do you want to do? Just let us know that you loved him, and maybe he'll come back. I said, what are you doing this for? And he said, I love this stuff. Whatever I do, I go and research it, and he tells his wife and he tells his family, and it's like, okay. So he's thrilled to have another audience as well. So that's part of his motivation. And he has a YouTube channel. So click on that. And Quinn, who's on holidays in Costa Rica, he was here today. I'm very happy with my team. I think they care about this as much as I do, and it almost brings tears to my eyes. Quinn, are you still out there, or did you go? He went to Costa Rica, but I know he popped in. I said, what are you doing here? You're on holidays. And he said, I know, I just had to see how it's going. So very dedicated team. And let's all thank Joe by clapping or whatever. Oh, Joe's leaving. Joe, where are you going?
I have to go to the hospital actually right now. I'm just walking over.
He's dedicated. Here he is Saturday. He's talked with us, and now he's going to the hospital. So let's give Joe our last slogan, which is I say something and you say something back. Ready? Okay, Joe, this is what you need to know. Ready, everybody? You make your unmute yourself. You make your brain, then
And your brain makes you.
Thanks, Joe.
Thank
Thanks,
you.
Joe.
Thanks, Joe.
Thanks,
Joe.
Talk
Thank
to
you.
Thanks, everyone.
Thanks, Joe.
Yeah.
Everybody.
Make a difference.
Thank you.